So South Africa has now passed the 100 days milestone of the national lockdown, 102 days today. And during this period, we've seen an upheaval to our personal lives, our work lives, and in some cases, even our health. But how have governance structures fared? According to Wits University Professor Ivor Sarakinsky, the pandemic has caused and exposed some major fault lines in our institutions, from flip-flopping on policy to introducing regulations not understood or supported by most. We've got plenty to unpack now. Professor Sarakinsky joins us via our Skype line. Good morning, Professor. Thanks again for your time on the AM Report. I think perhaps as a start, let's talk about the issue of communication around COVID-19 in South Africa. You and I, perhaps, we follow things quite closely because of the work that we do, but you think that ordinary South Africans are getting the information that they need around especially the seriousness of COVID-19, be it on our radio stations, from broadcasters? Is government doing the job of communicating well enough?
I'm not sure about that. It's an incredibly complicated matter, and that means one has to break it down into key issues and prioritize what you want to get through. And I think that that's where the problem has been. Social distancing, wash your hands, be careful. And yet we got bogged down in messaging about the enforcement of lockdown and what lockdown is at a legal, institutional level rather than at a behavior change level.
Yeah. I mean, that's an important point that you make, because it also speaks to, the buy-in that we saw from South Africans at the start of the lockdown. There was a sense that there was a lot of support for government locking down the economy quite early at the end of March. And then, as you say, we got caught up in issues around bans on the sale of tobacco products, bans on alcohol, and not enough focus on actually saying, this is why it's important to wash your hands. This is why it's important to keep that 1.5-2 meter distance from others at all times.
Yes, and that's part of the goal displacement. We just lost focus.
Yeah.
We started to get bogged down in a whole range of subsidiary issues instead of what the key issue was all about.
Yeah.
And I think that's where we've lost momentum. The fear of the unknown at the beginning of lockdown got people's buy-in, but that wasn't sustained in terms of the mixed messaging that followed.
So perhaps as a way of understanding the difficulty that government faces in communicating COVID-19 to ordinary South Africans, are there too many things that need to be taken into consideration here? Government needs to talk to business about what it needs as we try to restart the economy and keep the economy afloat amid COVID-19. Schools are needing to open. Parents can't stay home taking care of their children because they need to go back to work. There are so many interests that government is trying to balance, and it cannot be an easy job.
It's certainly not an easy job, and one has to acknowledge the difficulties there. But that doesn't mean it couldn't have been done better. So you get bogged down in issues around cooked chickens and stuff like that. And that just detracts from what the priority is. And the priorities is to make sure that people change their behavior to limit as far as possible the spread of this virus. And yet huge amounts of energy and space on media spent on squabbling about the rights and wrongs of hot chicken. Yeah. And that's the kind of problem that doesn't help. So yes, do the stakeholder engagements, get your information in place, make decisions, enforce the decisions in a way that they're credible so you get buy-in. And I think that's the main learning from the 100 days.
So in terms of, when we were analyzing issues around the lockdown since the start of COVID-19, let's say since the start of March, we often heard the phrase that it's exposed fault lines that already existed long before COVID-19 arrived in the world. What are some of the big fault lines? You've mentioned some just now, but some of the big issues where we've been found wanting in terms of service delivery, in terms of, for example, we're now seeing Gauteng is in a scramble to buy things like ventilators, PPEs, now at this stage on day 102 of the lockdown. So what are some of the issues that when we reflect on COVID-19 in South Africa, we're going to look back and say, this is what we could have done so much better?
I think one of the key flaws that's been exposed is the fundamental weakness of our public bureaucracies to do planning, to do foresight, to do scenarios, and to put in place actionable plans to execute policy. And this is a problem we've seen over the years. But COVID-19 has brought this to the forefront in a way where it can no longer be ignored, because we're seeing the tragic consequences of this. So a good example of this would be the hospitals in the Eastern Cape, just dysfunctional. And a range of other institutions in terms of getting grants to people. If you close down the economy, people lose their salaries. You need to get those grants to them urgently. It's taken a few months before the money even starts to flow. What have people been having to do in the meantime to feed themselves? At the same time, the limitations and flaws in departments like social development, just in getting food packages to people, the weaknesses in supply chain and the inability to ensure integrity in those processes are now in public display for everyone to see.
Yeah, absolutely. Professor, before I let you go, I want to just check in with you on the other issues that continue, despite COVID-19. We saw the AG's report released around 257 municipalities, I think it was just last week, again showing that municipalities are not able to manage their usual expenditure, never mind the additional expenditure that's been allotted under the pandemic. There's been VBS Mutual Bank, Florence Radilani, Daniel Caesar, reinstated despite those serious allegations against them, and of course the State Capture Commission of Inquiry also resuming its work.
Yes, so the Auditor General shows that most municipalities don't know what they're doing, to put it bluntly. And then you allocate another 20 billion to municipalities for infrastructure, for COVID-19, water, sanitation, all the things that should have been done years ago if money had been spent properly. So an extra 20 billion that can't be used properly, what's going to happen to that money? How much of it is going to achieve its goal? Because we see the documents from Oliver Tambo Municipality. Already the predators are looking for opportunities to access that money. And if you don't have proper systems in place, that money is not going to achieve its goals. It's going to go in all the wrong directions. And the people who need access to that resource won't get it. And that means that all the interventions, or many of the interventions to address COVID-19 are going to fail, and it's going to spread even further in communities that are the most vulnerable, who don't have resources that they really need. And that's maybe the tragedy of our weak institutions in delivering services.
And of course, when it comes to the money that's allocated during a pandemic, it's not just about weak institutions and failure to deliver basic services. It's about a very real risk to loss of life.
Absolutely. And that means that if you're going to refurbish clinics and hospitals and the money isn't used properly and you can't accommodate the patients who are queuing up, it means that their chances of survival reduce dramatically. And that's the tragedy of this, and that's why COVID-19 has exposed the weaknesses of our public sector to do the things that it has been supposed to do for the last however many years. And that is something government can just no longer ignore now. Yeah. A serious action plan needs to be put in place to fix the problems that are in the public domain.
And it's going to be interesting to see when we do look back on how we've managed COVID-19, what that picture does look like. Thanks very much for your time. Thanks for coming on to the AM Report. Professor Ivor Sarakinsky joining us there via our Skype line. 102 days of the lockdown so far.